We'll soon be going into the closing, but before we do that, we'll have a panel discussion. All the presenters are familiar except Anita Bhebhe. She's an epidemiologist with a background in pharmacy. She has participated in the implementation of newer COVID-19 therapies in low and middle-income countries. Anita is a member of the National TB Technical Working Group and the National COVID-19 Task Force. In her work, she has provided countrywide technical support in these areas. She has contributed to the development and dissemination and implementation of various clinical guidelines, including the Zambian COVID-19 case management guidelines. So before we go into the panel discussion, she has a few words, and then we'll transition into that.
Good afternoon to you all. As we look at the implementation opportunities and challenges in the COVID-19 space, I just thought to bring in a few insights. I didn't make a presentation, I just have a few notes that I have in my notebook. So like most African countries, Zambia, the Zambian healthcare system has a lot of implementation issues, a lot of implementation challenges, which stresses the need for implementation research and innovations. And I'm glad Dr. Sivile has just announced that he has a qualification in implementation research now. We need more people, more healthcare workers to do that. So I have been privileged to be at a health facility, which is the University Teaching Hospital, where most of these innovations in healthcare are piloted, because we are a center of excellence, especially when it comes to infectious diseases. A lot of lessons learned, a lot of lessons drawn from our experiences. I will start with governance, which is one of the challenges that we are currently facing. We have a lot of policies, guidelines at the national level, but what is noted is that these are not really trickling down to the lower level health facilities. And also you find that people are at the health facilities are not really taking ownership of these programs, such that whatever we want to implement is proving very difficult at that level. And an opportunity there is for us to develop a scenario where we have focal point persons, people that take actual ownership of programs when it comes to COVID-19. Another challenge that we've had as Zambia being a low-income country is finance. I think that we've talked about a lot of COVID-19 therapies, we've talked about vaccines, we've talked about testing, but do we have equitable access to these things as a country? There is need for us to improve and invest in local and regional manufacturing, which is something that even the president has spoken about. Local manufacturing is a space that we need to get into, especially that Africa is only contributing 1% of global pharmaceutical manufacturing at the moment. As we increase equitable access to tests and treatment and vaccines and personal protective equipment, we need to ensure that our supply chain cluster, our supply chain pillar is given the necessary, the nerves. Yes, the necessary support. Thank you so much. Yes, the necessary support, because supply chain is pivotal when it comes to any program that we're going to have in the healthcare sector. If we don't look at supply chain, we are going to miss out. So we need also to ensure that we look at acquisition mechanisms for therapies, tests and vaccines at regional level, and we need to also improve on our regional collaborations and pooled procurements for us to ensure that our people have these access to these therapies that we're talking about. One of the things that we have done is we've incorporated COVID-19 supply commodities into the ELMIS system, which has made it easier for us to improve on our data and visibility for national level decision making. And also we had our first forecasting and quantification for COVID-19 supplies and other epidemics last year, which has made it easier for us even to plan for these waves that we have. So at the healthcare level, I would like to speak about healthcare mentorship, the healthcare worker mentorship program. So we have trained healthcare workers. We've had different mechanisms of training. We've got classroom level trainings. We've got virtual trainings. But what is lacking and what might be contributing to the lack of ownership at healthcare worker level is continuous mentorship. We do have technical site visits that we've done across the country, but what I would encourage any healthcare system that we have here in Zambia is to ensure that we mentor our focal point persons in these healthcare facilities in a long-term plan. Of course, community engagement, patients need to be educated. There are a lot of patients who might be vulnerable populations that would need these therapies, but they are not aware that we have them, and they are not aware that they are at risk for progression to severe disease. We need to ensure that this information is out there so that patients are actually seeking these therapies at the healthcare levels. Lastly, and I think this point was touched on, which is antimicrobial resistance. We need to ensure that antimicrobial stewardship programs are part of our pandemic preparedness. I think that Dr. Nyambe and Professor Mlenga did speak to this, and I'm glad that plans are already in place. Lastly, the COVID-19 resurgence plan needs to be well incorporated at all healthcare facilities at all levels. And we are currently working on an assessment of preparedness tool that is currently in development, and I think that once we share this with different facilities, they'll be able to score themselves on how prepared they are for different epidemics, including COVID-19. Thank you so much.
Thank you so much, Anita. Just to add that we do have one of the biggest eco platforms in the country, led by Dr. Ziambo and coordinated by Kunda in terms of capacity building. So we'll now go into the panel discussion. Thank you. Do we have any submissions, any questions to the panel? On the panel, we had Dr. Berger. I don't know if he's still with us. He showed us quite a lot on drug-drug interactions. We had Dr. Chitanika talking about TB and COVID-19 and the potential drug interactions. Dr. Sivile speaking of anticonvulsants. On the panel, we also have Anita Bhebhe, who did a very nice wrap-up and summary of this meeting. And then we also have Dr. Nyambe, who actually was the first speaker today.
Thank you so much to all the presenters. I think just to get a comment from the panel on opportunities that exist in building capacity when it comes to research. I think one of the themes that is coming out and one of the lessons that we learned from the pandemic is just the importance of African young researchers. So just maybe a comment from the panel, some of the opportunities that exist and some of the efforts that are going into building capacity into the young researchers in our settings. Thanks.
Thank you to all the presenters today and the doctors. My question is just on opportunities. This is to all the presenters. So from the pandemic, genomics was quite important in giving us the ability to track the different strains of COVID-19. But my question is, with regards to the same genomics, do you, in your own expert opinions, believe that pharmacogenomics could provide a better tailored solution to better implementation strategies that would allow doctors and healthcare professionals to understand the single nucleotide polymorphisms in the liver enzymes of the patients so that you are able to better tailor a more specific treatment plan for the patients based on the local population and not just based on the population outside Africa.
Yes.
Good evening. Good evening, everyone. And thank you so much for the opportunity to just listen to great presentation this day. My name is Nyambe. I'm with MOH in the HIV program. I just wanted to just bring this to everybody here. It's not something that has been discussed in the previous panel presentations, but I think it's an important component, and you will all agree with me. And that is part of preparedness for these kinds of things includes data management and capturing systems. And I think one of the things that that caught us really badly was one of those is data management and capture during COVID, and still the same thing that we seem to have also struggled with in terms of the cholera outbreak. And I think it's a discussion that we need to have to be very candid about it and be honest about it and get to address all the real issues that exist, because we know that it's good decisions are made out of informed data and things that are making sense. And so I just thought I should just bring it on record. That is something that we need to be thinking about through all the arms of government, MOH, ZNPHI, and all our partners involved. I think we need to address this particular problem. I submit.
Thank you so much, Dr. Nyambe. We only have 5 minutes. Should we take one more question before the panel? Okay, we'll take that last one. Thanks.
Okay. Thank you so much. My question is based on supply chain. I'm very glad that Madam Anita mentioned that for us to be able to effectively handle some of these outbreaks that we have, what is needed is a robust supply chain system. So the question that I have is, following the forecasting and quantification exercise that you had, I think you mentioned last year, do we have a lead time as to when we expect most of the logistics to be in the country? Looking at the way the situation is going, we have an upsurge in the numbers of the COVID-19 cases that are being recorded. So if in the next 2 months we get to a point where we consider it an outbreak, how ready are we as a country to handle that in terms of the logistics, especially PPEs and possibly the therapeutic agents that we need? Thank you.
Thank you. We are running out of time. I'll allow Anita to take that one, then Dr. Chitanika, you can speak to that. Dr. Sivile will take up the one on the research opportunities and capacity building. And Dr. Nyambe, are you able to take up the one on genomics and the SNPs? So Dr. Nyambe will talk about the genomics, and I'll leave out the SNPs part because I know we'll consult someone just now, because that's precision medicine, I believe, is what you're talking about. Yeah. Yeah.
Thank you for that very important question. I want to just start with the fact that right now where we are at with COVID-19, we know, we sort of are able to anticipate waves. We know that we have one big wave around festive season and another around our winter, which is June, July. And as the supply chain team, we are definitely prepared for these waves. Of course, we have a few outliers, some cases that will not follow this pattern, but we do have the therapies, we do have the personal protective equipment, and we do have the vaccines in the country. The only problem that we have is we may not have a lot of healthcare workers really preparing at their facility at that level, and that is what we are encouraging. That is why I talked about the preparedness tool that we would like to disseminate at this point, so that these healthcare workers, these health facilities are not shocked whenever they start receiving positive cases and they don't have the commodity at their facility, yet it is there at central level. So it is my encouragement to everybody in this room to ensure that whatever facility they're coming from is prepared for the next wave, which we're anticipating will start around May, June, somewhere there. But don't wait until May and June, because of course you talked about lead time. We know that is one of the challenges that we have in supply chain. It takes time for us to have these commodities in our facilities. Preparedness is very, very important. We need a resurgence plan, not only at national level, but even at facility level. Thank you.
Thanks, Anita. Dr. Sivile or Dr. Chitanika, do you want to quickly say something on the supply chain? Just there. Okay. Dr. Sivile, the research capacity. Just appreciating Dr. Ziambo's comment on the need for a strengthened health information system as well. I know we have a lot of policymakers, clinical care specialists here, so thank you, Dr. Ziambo.
Yeah, thanks for the comment and question on research. Yeah, so during the epidemic, we learned that first, research is possible even during the epidemic. We did a few studies and so on. It's possible, but we also saw, say, NHRIA, relaxing some of the requirements and so on and so forth. But a specific question on how can young researchers build their capacities? I think my advice is for the young ones is to start where you are. I think the biggest challenge for the young people is first to think of research as something very complicated and not give themselves the opportunity to learn. Some thinks research is this way of making money and so on and so forth. So you can actually do research, say if you are a doctor in the ward that you are working. If you are a nurse, we have seen very little appetite for research from our colleagues, the nurse, in the ward. You are seeing things. Are you documenting those things that you are seeing? Yeah. And of course, I still think we do have quite a number of organizations that you can participate and learn first. I think that's the first thing you need to do. Before you want to be the PI, write your own grant and that sort of thing, you need to learn. So hook yourself into groups. That's the way it works. You need a team. You need a group. You need a team. There's ZNPHI doing research. There's CIDAS. There's ZAMBAT. There's UTH. There are so many groups. Hook yourself into those groups. That's my advice for young people. You can't write a grant and win a grant alone, say, I know research. Yeah, thanks.
Thank you so much, Dr. Sivile. I'll just ask Dr. Nyambe to briefly touch on the issue of the status of genomics in this country. I'll leave out the part of the single nucleotide polymorphisms in terms of precision medicine and what we are doing as a country. I will defer to Audrey, whose PhD was on pharmacogenetics, and she can tell us if anyone is doing work around that. I hope that's okay. Thanks.
Thank you so much, Dr. Sombo. So just to mention that there is a consortium that looks at genomic sequencing, and they meet at least every month once, and those are some of the issues that they're actually discussing. It looks like a good way to go in terms of precision medicine for now, but I think we need to build a lot of infrastructure to support that. Maybe starting on a syndromic approach, like what is common in regions like sentinel sites, picking up data from there, and then using such information on a local basis to be able to generate more tailored treatments in sentinel sites. But of course, once the infrastructure is strong enough, it can be personalized to more precision decision-making for each of the pathogens. But also wanted just to comment also on capacity building for research. I think under the ZNPHI, we all know that there's the field epidemiology training program. Among the things that the program does is also to capacitate trainees in research. And this research can also be implementation research, but suffice to mention that it's offered to government employees. It's an in-service training for now, where we target all levels of care, district, provincial, and national level. So we have the frontline program, the intermediate program, and the advanced level program. So under advanced level, each of the trainees is expected to conduct at least one research, which is important in terms of public health response. And at intermediate level also, we expect them to conduct a group project, which is mainly around implementation research based on the key priority areas. So this is offered at ZNPHI. For those that are interested, may look into that space and see how you can also benefit from that opportunity. Thank you.
Thank you. Dr. Audrey, any comment?
Thank you very much. Thank you very much, Dr. Sombo, for putting me on the spot. But just to comment on the opportunities that would be there in looking at how genetic variants in the populations would determine the different treatment outcomes. I do feel, and I think there is data showing that there are some drugs that can be, whose treatment outcomes could really be as a result of the different genetic variants. So that's looking at the patient's genome and how, in terms of the drug, it could be pharmacokinetic pathway, and how that drug would affect the treatment outcome. So definitely there's been studies that have been done in, I think, with regard to remdesivir, and it has shown that if we were to look at the genetic variants that patients have in terms of determining their treatment outcomes, it can actually improve, optimizing as well as applying the precision medicine, as it were. But for single nucleotide polymorphism, I think there's an opportunity because COVID-19 is still new with us. So we're still having new lessons to look at different drugs. But we all know that we are a unique individual, and therefore there's always a place where genetic polymorphism could actually determine the differences that we see in the treatment outcomes in our patients.
Thank you so much, Audrey. So the session chair is back. We will soon be going into our closing. Of course, thank you to all of you who spared today to join us, and Virology Education for making this possible.